Making language become woke is crazy. How's everybody doing? My name is Anthony Brian Logan, and today we got to talk about monkeypox getting a rebrand right before a specific month in the year that brings about certain events that might make cases of the monkeypox exponentially rise. Now, a lot of y'all are really smart. You're genius level people. You know what's coming up that may make this whole thing pop. But before we get into it, let's look at the reason why they've renamed and rebranded monkeypox and what the brand new name is. Of course, everything will be in the description box. This is from the WHO website, World Health Organization. And you see the headline, WHO recommends new name for monkeypox disease. Now, you know what this is. This is a thing where you got all these big blisters on you. It's spread among men, LGBT men, and it was called monkeypox. That's what it was. It was a whole big scare last year, maybe even the year before that, right after C-19 that died down. I was like, okay, we got a brand new bug coming out. And when they announced this bug, people were so conditioned by C-19 and the fear behind that, they went out and bought more masks and started to wear more masks. I noticed a dip in the mask wearing, but then when the new virus came out, mask wearing increased. But that's a different story. I digress. Let's get right back to it. Why did they rename monkeypox? And what's the new name? The new name is Mpox. The letter M, P-O-X, all one word, Mpox. That's the new name. Okay, so you may see certain headlines that say Mpox, or they may refer to it as Mpox. They're not just saying monkeypox for short. That's going to be the new name, Mpox. It's kind of like what they did with Kiev. I thought it was pronounced Kiev, not Kiev. They do things like this all the time. And they also have certain words they use, birthing people rather than mothers. But I'm going way down the rabbit hole way too early. Check it out. Following a series of consultations with global experts, the WHO will begin using a new preferred term, Mpox, as a synonym for monkeypox. Both names will be used simultaneously for 1 year while monkeypox is phased out. When the outbreak of monkeypox expanded earlier this year, racist and stigmatizing language online in other settings and in some communities was observed and reported to the WHO. Now, racism, really? Because as far as I know, monkeypox was a thing that really spread in Europe and North America, like USA, among gay men. And I'm going to jump out on a limb and say the majority of these guys were white men. So you got white gay men getting this disease from having relations with each other in a highly promiscuous environment, but somehow monkeypox is racist. I don't understand how that makes any sense. But different story, I digress. In several meetings, public and private, a number of individuals and countries raised concerns and asked WHO to propose a way forward to change the name. Assigning names to new and very exceptionally to existing diseases is the responsibility of WHO under the International Classification of Diseases, ICD, and the WHO family of international health-related classifications through a consultative process, which includes WHO member states. So that's just what it is. Talking about Tedros and everybody else. Okay, they're talking about Mpox rather than monkeypox. I mean, it's kind of lazy if you ask me, but I guess you call it Mpox so you kind of know what it is. You know what it's referring to, and you're not confused too much. They don't want to name it onomatopoeia. They don't want to name it the Tedros Adhanom disease or anything of that nature. So they're going to say, okay, Mpox. That'll be pretty much what it is. All right. But let's continue here because there's more. We have a video because you have to understand there's a reason why I'm talking about this right now. It's not just for no reason, because this Mpox term was created in September of 2022, as far as I know, maybe even November. It was last year, 2022, and we are now in May of 2023. So here's $1 million question. Why am I just now bringing it up? That's a great question, and I'm glad that you asked. Let's get into this video right here. If you want to see it in full, you know where it's at. It's in the box. If you are on IG, link in the bio, go to the corresponding article on the website. But let's watch this video right here. Then we're going to get some insight. And before I start, I'm going to give these people credit. I'm not sure where this is, what news outlet this is, but I want to give them credit for being so open and honest, or at least kind of open and honest. Let's check it out.
A new warning from the CDC about a potential risk for new cases of Mpox to surge this summer.
We're coming up on Pride Week right now, when there are a lot of celebrations within our populations that are at highest risk for getting Mpox. And we don't want to see a month-long celebration turn into a tragedy.
So what does this mean? Okay, we got Pride Month coming up, and there's a lot of celebrations happening among those who are highest at risk. We know what that means. What that means is we got Pride Month coming up, and the boys are going to be out on the town. They're going to be having a lot of quote unquote fun with each other. And this is the highest risk factor for the disease to spread. NBC News put out an article, and I might try to find that in a minute. Matter of fact, let's do that right now. We could do it on the fly. NBC News put out an article where they said that the disease monkeypox is spread because of sex between men and not body contact. They were trying to say, oh, it's body contact, is you know, getting contact with the sores, all this, that, and the third. No. See, here it is right here. I got it up on my screen. Let's go ahead and get right back into it. Okay, check it out. NBC News, it says sex between men, not skin contact, is fueling monkeypox. New research suggests. And then the subhead, let's look even deeper. The claim that skin-to-skin contact during sex between men, not intercourse itself, drives most monkeypox transmission is likely backward, a growing group of experts say. So they're saying specifically sex between men is what's driving monkeypox. So that's why you're hearing about the new Mpox term that was coined last year. You're hearing about it right now because they know Pride Month is upon us. It'll be here in just a few days. We're at the end of May. In a few days, they're going to have Pride Month, all these celebrations, all these group activities going on. They know that the disease is going to spark. It's just that simple. But let's continue with the video to see if they expound on that fact.
Mpox is a viral disease that spreads through close contact. It can infect anyone, but in the 2022 outbreak, infections were mostly among men who have sex with men. Right now, a cluster of Mpox cases is being investigated in the Chicago area, where the CDC says there have been at least a dozen confirmed cases and one probable case reported between April 17th and May 5th.
And let's pause for a minute. You know, when I'm talking about Mpox, monkeypox, and the LGBT population, gay men really that are highly promiscuous with each other, I'm not saying that to attack these people. I'm just saying that's going to be the people who are most at risk. So if that's you, protect yourself. Okay, if that's you, you have a very high chance of getting monkeypox. It'd be the same thing if people that had red hair were at high risk of getting some kind of crazy random bug that nobody ever heard of before. It's like, okay, redheads out there, the country of Ireland, y'all be on the lookout. Please protect yourselves. That wouldn't be anti-Irish or anti-redhead. It'd just be a thing that's real, and it's just a public health and safety notice. It's a public safety announcement. That's what this video is right now. And there's also a way for you to understand what they do with language, try to make you think differently other than what reality is. Let's keep on going.
All the cases were among men between the ages of 24 and 46. All had symptoms, but none of the patients has been hospitalized. 9 of those 13 cases were among men who had received both doses of the 2-dose Jynneos Mpox vaccine. 4 of the men had recently traveled to New York, New Orleans, and Mexico.
We don't know how long the vaccination is going to provide immunity, nor do we know how long necessarily natural.
I mean, if it gave you immunity, then obviously it didn't work because I think most of the guys that got it had the vax. So what does the vax even do? I think at this point, it just put anything out there to see if it works. And if it does work, great. If it doesn't work, oh, well, you're not going to sue me. And if you have debilitating side effects years later, then so what? It is what it is. That's kind of what I'm thinking. Maybe I'm wrong about that. Let me know what you think about that in the comments.
Disease is going to provide immunity.
Dr. Kristen England with Cleveland Clinic says it's still important for those at highest risk of Mpox to be vaccinated.
For folks who have been vaccinated and still get Mpox, It is strongly suspected that the Mpox that they currently have is much less severe than it would have been if they had not gotten the vaccine.
I'm Mandy Gaither.
Sure. I mean, tell us anything, huh? So that's a new warning, because you got the brand new, well, not the brand new, you're going to have a new surge of this virus because of Pride Month. That's what they're saying. They're saying, yo, it's Pride Month coming up. We know it's going to be gay men engaging in a bunch of activities with each other. So you're going to have a big rise of monkeypox, now known as Mpox. But as I close, I want to say this. This report was kind of honest. I was surprised they really pointed out the fact that this particular bug spreads amongst LGBT men. I was very surprised at that. Very surprised. And they didn't talk about trans, all that kind of, they said men, biological XYs, keeping it all the way real. So shout out to them for that. But the name change, I'm not really convinced. The racism part, again, you're talking about the cases were largely in Europe and North America, USA, a lot of white guys. I don't really see it. People going to say they're going to say that kind of stuff online. Is that really, is it serious? Obviously it's not, because who's catching it and who's not. But I think I'll leave that right there for now. And what say you? How do you feel about the brand new name for monkeypox, Mpox? How creative, right? Whatever your thoughts are on the whole situation behind the name change and the new name, let me know in the comments below. How you feel about this news report being somewhat honest about how this new outbreak could happen and where it could happen and in which population it could happen. Whatever your thoughts are, let me know in the comments below. You guys know where I'm at. I think a lot of this woke language they use is weird. It kind of obfuscates things at certain points. You don't know what's happening. But here is kind of similar, but it still points to a pattern of trying to make people think things different other than what they are. All you got to do really is just be straightforward. People that want to talk crazy online or whatever, so what? I mean, what's more important, a few online trolls or just knowing what the reality of a situation is? Whatever your thoughts are, please let me know in the comments below. And that's all I got to say for this video. If you like what you heard, please comment, rate, share, and subscribe. Peace.